Concerns are rising in India over the outbreak of the deadly Nipah virus, with the Kerala government confirming 5 positive cases and 2 deaths. The rise in cases comes after a health worker who came into close contact with a Nipah patient tested positive. The state government has announced containment zones now and restrictions to stop the spread of this virus. Contact testing process is being carried out at a large scale now, and close to 700 people are being monitored. 77 of them are in the high risk category. Nipah is a zoonotic virus. That means it is being transmitted to people from animals. It mainly affects animals such as bats, pigs, dogs and horses. Though the infection does not spread as quickly as COVID, the case fatality ratio or proportion of deaths among those who test positive is very high. As per the World Health Organization, Nipah has a fatality rate of anywhere between 40 to 75%. The state of Kerala has experienced multiple Nipah outbreaks. It first reported the virus in 2018, when 21 of the 23 infected people died. In 2019 and 21, Nipah claimed 2 more lives in the state. As the virus spreads through close contact, the Kerala government has strengthened measures to contain it. Mass testing will begin in areas where these new cases have been found. Several areas have been declared as containment zones, and no travel out of these areas will be allowed till further notice. Local self-government institutions and village offices will function with minimum staff, while banks and government educational institutions will not operate. Government has also advised people to maintain social distancing and use masks and sanitizers in these zones. There is currently no vaccine for the virus. The symptoms usually begin with a fever, a headache, cough, sore throat, like COVID. Nipah too can result in shortness of breath or in breathing difficulties rather. But the situation goes from bad to worse the moment a patient develops encephalitis, that is the medical term for a major swelling in the brain. Encephalitis comes with a fresh set of symptoms that includes drowsiness, disorientation and mental confusion. And for more on this, we are now being joined by Dr. Vivek Nangia, Chief of Pulmonology at the Max Hospital, Saket in New Delhi. And Dr. Nangia, thank you very much for joining us this evening. Now, there are several concerns about, the Nipah virus, the fact that a lot of the symptoms are like COVID and the fatality rate is rather high. What can you tell, people who are concerned about this virus at the moment?
So basically, we need to understand that this is a zoonotic virus, which has been transmitted from animals or mammals into the humans. And the first time we ever came to know about this virus was way back in 1999 in Malaysia, when a few cases were reported there. This is a highly virulent virus and gets transmitted very easily. The transmission could be either as a droplet mechanism, just similar to COVID again, if the patient is coughing, or through the respiratory secretions, or by direct contact. This contact could be either with urine or blood of the patient who's already suffering with this illness. So it is very important for us to know the mechanism of transmission and the fact that the incubation period is 4 to 14 days, but could extend up till 45 days. That means somebody could develop symptoms even after 45 days of having been exposed to a patient or an index case of Nipah virus. This is basically in India being transmitted from fruit bats or probably pigs, which is coming into the humans now. So we need to be careful in as far as contact with these mammals is concerned, and also with certain fruits, especially the raw dates, sap fruit, which can actually result in transmission. So avoid having any contact with any of these animals, avoid having any of these fruits, especially if the fruit is fallen down. Avoid contact with a patient. So whenever you're dealing with a patient like this, whether at home or in the hospital, it is important to follow all standard precautions and barrier nursing,
right,
which is very, very essential to contain the further spread of this virus.
Right, Dr. Nangia, there's a very important point you're making, that the incubation period could be anything from 4 days to 45 days. So that would be a real challenge for the government to identify potential cases going forward. But what are, you talked about precautions, but what are the symptoms that could, differentiated in some way to COVID and other such viruses?
Right. So basically, this usually happens within 4 to 5 days of your exposure to a patient who's already suffering with Nipah virus. The usual symptoms would start with cough, cold, headache is very predominant, which is not the case in COVID. COVID people usually wouldn't have a headache. So here, headache, congestion, then gradually resulting in dullness, disorientation, hallucination setting in, seizures, and finally progressing to coma. As the degree of illness keeps worsening, the degree of conscious status goes on deteriorating.
Right.
So that is what you need to watch out for. Headache is the most prominent symptom that should alert anybody of the possibility of a Nipah virus infection.
Right. Very important points there. Thank you, Dr. Nangia, for sharing all of that. Chief of Pulmonology at Max Hospital, Saket. Appreciate you joining us and telling us more details of what we need to know about the Nipah virus.